The vaccine has left the factory in Michigan and is on its way to the first destinations.
Here to talk about the nuances of distributing a vaccine is Dr. Siddhartha Mukherjee, founder of Athena. So good morning to you, Doctor. Thank you for being here this morning on this important morning.
My pleasure. Thank you so much.
So we spoke to UPS last week about really flying these to certain sites, but you yourself have been helping the U.S. military in some states across the country with vaccine distribution. So what role is the company playing in all of this, and what should the public know?
It's not the military that we're helping. We're actually helping the hospitals get the patients vaccinated, especially frontline workers and essential workers. Athena was founded on the idea that we need a digital platform. This is not like flu vaccine. This needs a booster shot. It needs to be stored at the right temperature. It needs to be deployed in the right place, right person, right time, and with the right booster shot. So Athena is a digital platform that allows people to get the vaccine on time. They're assigned the appropriate priority, and they get the booster reminder on time, and we follow them as their journey of vaccination continues for several days and weeks after vaccination to record any serious or any other kinds of side effects.
Dr. Sid, is there some concern that, this vaccine has to be kept at extremely cold temperatures? That's going to complicate the distribution. How challenging is that going to make this distribution? We've heard from other folks saying, it's not going to be that big of a deal, but truly, is it something that you're concerned about?
Yeah, it is an extremely challenging proposition because it needs to be kept, as you know, at minus 80 degrees. Once you open the vaccine vials, they come in big, large vials. Once you open the vaccine vials, you can keep them at a slightly lower temperature until you vaccinate. But once you open, it's opened. So I think there are, I know that virtually every hospital facility has created multiple backup freezers and backup freezers in order to keep the vaccines at the right temperature. They will have to be brought out of the freezer, thawed. A barcode has to be read to ensure that it's the right vaccine. We have to ensure that the Moderna vaccine, which has not yet been approved, but will be approved soon, and the Pfizer vaccine are not mixed up. You don't get, the Pfizer vaccine first and the Moderna booster.
Exactly. UPS told us
that's what Athena does. That's all of what I call the digital infrastructure of vaccination that Athena is built to do.
That's a very good point there about the mix-up of the two. UPS told us that they're going to have sensors in the individual packages to make sure that it doesn't go off temperature. But if it does, right? If it's not maintained at that temperature in transport, is it unusable?
We don't know yet, but the chances are that those vaccines will have to be tracked. So that's why we need the barcoding. That's why, and again, this comes back to Athena. When a vaccine is given, there's a barcode with every single vial. That barcode needs to be recorded so that if later UPS comes back and says, oh gosh, based on our recordings, it turns out that, this batch was not appropriately shipped. We need to go back to that batch and say, well, how many people got that batch? Who got that batch? Can we audit that batch? And can we make sure that we give them either a repeat vaccination or follow them to make sure that they get the appropriate vaccine?
Can you also do that, though, after it's been thawed and administered, just in case the thawing didn't occur correctly or had been thawed out too long and then was administered to someone?
That's right. So Athena has a mechanism by which everything is timed. So as soon as you pick a vaccine out of the vial and out of the freezer, and you sign the barcode, it starts a clock ticking. And every step, the thawing, the drawing up into the syringe, et cetera, you put a check mark on it. So we will know for every vaccine what is exactly happening and at what point of time, and it can be backtracked. It's like a ledger system. Imagine a giant ledger across 300 million vaccinees that allows you to search all of this in real time.
This is not an easy task, and one that we've all been waiting for. It is certainly fascinating. Doctor, we thank you for taking the time with us. And when we get word about Moderna, you're welcome back to talk to us about what you've learned from the Pfizer rollout and what you can use from those lessons from Moderna as well. Appreciate your time this morning.